So I had chosen my cat topic based on what I had seen in general surgery. I had seen multiple human-assisted choles done laparoscopically, and then I saw a robotic-assisted lap chole done as well. So that made me wonder if there were any advantages or disadvantages doing the robotic-assisted versus human-assisted. My particular patient came in complaining of bad abdominal pain, nausea, vomiting. Her HPI was that she was a patient 40-year-old Caucasian female with past medical history of obesity and hyperlipidemia who presented to the hospital with complaints of nausea and vomiting ×2 and increasing pain in her right upper quadrant, which radiated to her right shoulder for the past 2 days. She stated that the pain was associated with eating fatty foods, and she denied relief with any over-the-counter pain medications. Physical exam-wise, her vital signs were relatively stable. She did have an elevated blood pressure at 130/82 and a slightly elevated temperature at 99.8. Her pulmonary and cardiac exam were stable. Her abdomen physical exam did show tender to light palpation in the right upper quadrant, tender to deep palpation diffusely in her abdomen. She did have a positive Murphy sign, and her bowel sounds ×4 quadrants were still active. She had an ultrasound of her abdomen done, and that showed a gallbladder wall thickening and distension. And then there was also presence of 2 moderate-sized gallstones. She was diagnosed with cholelithiasis with acute cholecystitis, and the plan was then to schedule her for a robotic-assisted laparoscopic cholecystectomy. Just as a background for the robotic-assisted lap choles, there are different types of them. Some of them just hold the camera and then can be controlled by the voice or head movements of the surgeon. And some of these robotic-assisted can actually hold the camera and all the instruments, which are then controlled by the surgeon using a console. So the role of these robotic-assisted lap choles are still uncertain, and that's why this article was made. And as for my PICO question, my P for population was 48-year-old Caucasian female. The intervention I was robotic-assisted lap choles, and the C for comparison was a human-assisted lap choles, and the O for outcome was measured by decreased mortality, morbidity, and adverse events. My overall question was then, for patients requiring a gallbladder removal, is robotic-assisted a beneficial alternative to human-assisted in laparoscopic cholecystectomies? Based on my research, my best evidence article's title was Robot-Assisted versus Human or Another Robot-Assisted in Patients Undergoing Laparoscopic Cholecystectomies. Based on this article, it's concluded that there is no significant difference in robotic-assisted lap choles and human-assisted lap choles in the outcomes of mortality, morbidity, adverse events, conversion to open choles, and operating time. How this research will affect me in the future is just to provide patient education on how the procedures are done in both the robotic-assisted and the human-assisted, letting them know the difference in how the actual procedure is done, but also educating them that the results are just as safe in the human and robotic. So just in case any of the patients have any reservations for the newer procedure in the robotic, they can be reassured that they are just as safe. Additionally, if the surgeon is more comfortable using the robotic, then they should be comfortable in knowing that that procedure is just as safe with using human assisted. However, there needs to be more research done to see if there are any other secondary benefits using a robotic versus human assisted, such as cost-effective measures and the number or duration of assistance needed and the post-op stay time. And that is my cat topic and what I found. Thank you.